Hi, my name is Adam Jaratanian, and I'm the co-founder and CEO of Bright Paths Recovery in Los Angeles. Today, I want to talk specifically about meth addiction treatment, because methamphetamine affects the brain and body in ways that are often deeply misunderstood. Meth use doesn't just create a habit. It fundamentally alters how the brain experiences motivation, pleasure, focus, and emotional connection, which can make stopping feel mentally and physically exhausting. Meth is a powerful stimulant that floods the brain with dopamine, the chemical responsible for motivation and reward. Over time, the brain reduces its own ability to produce and regulate dopamine naturally. This can leave individuals feeling emotionally flat, depressed, disconnected, and depleted when meth use stops. These changes are not permanent, but they do require time, structure, and professional support to heal. One of the most challenging aspects of meth addiction is withdrawal. Meth withdrawal is not typically medically dangerous, but it can be emotionally intense and physically draining. Common symptoms include extreme fatigue, low mood, sleep disruption, increased appetite, irritability, and strong psychological cravings. The emotional crash after stopping meth is often one of the biggest barriers to recovery. The meth withdrawal timeline tends to look different than other substances. Many people experience an initial crash phase marked by exhaustion and low motivation, followed by a gradual return of energy and emotional responsiveness over the coming weeks. During this time, support and structure are critical. Without them, it's easy to return to use simply to escape how empty or uncomfortable the early recovery phase can feel. At Bright Paths Recovery, meth addiction treatment begins with a comprehensive clinical assessment. We take the time to understand substance use history, mental health concerns, physical health, and personal circumstances. While meth withdrawal does not usually require medical detox in the same way some substances do, close clinical monitoring and emotional support are essential during early stabilization. Clients then transition into our residential meth addiction treatment program, where the focus is on restoring balance to the brain and body while building sustainable recovery skills. Residential treatment provides a structured environment that removes access to substances and outside triggers, allowing the brain time to begin healing. Therapeutic care during meth addiction treatment is grounded in evidence-based approaches such as cognitive behavioral therapy, motivational interviewing, dialectical behavioral therapy, and trauma-informed care. Treatment focuses on rebuilding motivation, improving emotional regulation, addressing impulse patterns, and restoring a sense of purpose that often gets lost during stimulant use. Many individuals struggling with meth addiction also experience anxiety, depression, trauma, or difficulty experiencing pleasure or connection. That's why Bright Paths Recovery offers integrated dual diagnosis treatment addressing mental health challenges alongside substance use. Treating both together supports deeper healing and reduces the risk of relapse. Recovery from meth addiction also requires physical restoration and routine. Sleep, nutrition, and daily structure play a major role in helping the brain recover dopamine function over time. At Bright Paths, clients receive chef-prepared meals designed to support physical recovery and energy stabilization, along with a daily schedule that balances therapy, rest, and skill building. Our Los Angeles setting provides a refined, comfortable environment that supports healing without overstimulation. Family involvement can also be an important part of meth addiction treatment. Meth use often affects trust, communication, and emotional availability. When appropriate, we offer family education and counseling to help loved ones understand the recovery process and support long-term stability. As treatment progresses, we focus on relapse prevention and aftercare planning. Meth cravings can resurface during periods of stress or low mood, even after initial stabilization. Each client works with our team to develop a personalized plan for continued therapy, support, and healthy structure after residential treatment ends. Our meth addiction treatment program in Los Angeles is designed for adults seeking compassionate, evidence-based care in a structured residential setting. Whether meth use has been ongoing or more recent, professional treatment can help restore clarity, motivation, and emotional balance. If meth has taken more from your life than you want to admit, reaching out may feel difficult, but it can also be the first step toward real recovery. Our admissions team is here to listen, answer your questions, and help you understand your options with respect and care. At Bright Paths Recovery, we provide thoughtful, evidence-based meth addiction treatment designed to support brain healing, emotional stability, and long-term recovery. When you're ready, we're here to help you take the next step.